Good evening, everyone. Thanks very much for joining us. None of us look forward to them, kids especially, that prick of the needle that promises to spare us or quite possibly could spare us. A rather more stressful, painful episode in the days, years to come. Vaccinations, measles, mumps, shingles, pneumonia, the flu. Most of us begin receiving vaccinations in our earliest weeks of life. But we need a booster every so often, the product or demanded by a new virus or a new disease or the resurgence of an old scourge. And new research as well. But what seems to so many so obvious, so necessary, so commonplace can be overlooked in the rush of our lives. And then there are the controversies surrounding immunizations. Some of them political, others ethical, religious, often very emotional. We'll try to address them all in the next hour with our panel of experts, including Dr. Gary Wheeler, Chief Medical Officer of the Arkansas Department of Health. Dr. Chad Rodgers is Chief Medical Officer for the Arkansas Foundation for Medical Care, and Dr. Robert Hopkins is the General Internal Medicine Division, Director of the University of Arkansas for Medical Sciences. Gentlemen, doctors, thank you very much for being with us tonight.
Thank you.
Let's start this way. Where, if we can determine, if we know, where is Arkansas in compared to our other states in the level of coverage, the level of the reach of our immunization? Dr. Wheeler?
Sure. So it kind of depends on what category we're talking about. People will receive immunizations at all different ages, and we monitor those. By and large, we have been sort of in the middle of the pack with our immunization coverage. A few years back, we sort of dwindled. We've pulled back to about where we ought to be, in the middle of the pack. Whether you're considering very young children in the first couple of years of life, teenagers, or adults. We've got room for improvement in a lot of those areas, and we're working on that.
When you say where we ought to be in terms of, how do you reach that judgment by?
Right. So there are
character of the population.
Sure.
Or the disparity?
We have targets that have been generated at federal level about certain levels of immunity that are appropriate to preserve immunity in the community or herd. And those are set for each one of the vaccines. And we're pretty close on many of those. Other ones, we've got a long way to go, particularly our new vaccines.
And let me go back to the audience very quickly and remind you that this is your program. Your questions are very much appreciated and invited, solicited in fact. 1-800-862-2386 is the toll-free number. You can also email us at paffairs@aetn.org, or you can join us on Twitter at AETN #something. We'll put it up there on the screen. And we invite, really, we want all of you as possible, as many of you as possible to call in. We have operators standing by. Where do we, gentlemen, where do we fall short on under the rubric of immunizations? Where are we really low?
Well, I think, for children particularly, for the vaccines that aren't particularly required for school entry, we have fallen behind and not maybe have started a series and are not completed a series. A lot of kids have gotten a hepatitis A, for instance, but never have gotten their booster. And then we also have a lot of our young adults who started a human papillomavirus vaccine and never complete the series, so they're not completely protected. And those are probably one of the biggest areas that we struggle in, just getting kids in to get those boosters so that they are fully immunized. I think also when the schools don't require them, a lot of the times parents kind of see them as optional, and I think unfortunately sometimes in the medical community we have also seen them as optional, and really these are vaccines that are very vital to protecting your life and preventing you from getting things like cancer.
To what extent does continuity of care, or maybe I should say the discontinuity of care, factor into this, where we may overlook a booster or we fall behind?
I think it's a huge issue. If whether you're talking about childhood immunizations, adolescents, or adults, if you have a long-standing relationship with a practice or a particular provider, you're much more likely to continue to get vaccines, particularly if that provider is recommending those on a regular basis. One thing that we in the medical community have recognized more and more over the last decades is that really, if we're going to effectively vaccinate our population and protect them from all these illnesses, it can't just be the doctor. you've really got to have a team focused on trying to do those prevention activities. From the registration clerk at the front desk to the nurse or medical assistant to the doctor, everybody targeting the idea that you need your cholesterol screen, we need to check your blood pressure, we need to do your developmental screening for the child, and by golly, we got to get that flu shot into you to reduce your likelihood of having true flu or pneumonia or whooping cough or many of these other things we can prevent.
That would appear, doctor, to be doctors to be necessarily to include public school, well, public and private schools anyway, education in the earliest grades and perhaps all the way through the K-12 process.
Right. And we look at that. We have a program in Arkansas where all of the schools are required to meet certain immunizations. There are certain vaccines, a core set, that are required for any of our kids to be in daycare, in public schools, and even into our colleges and universities. But there are also a number of other vaccines that are important that are not mandated. The HPV vaccine, the human papillomavirus vaccine, is one, and part of that boils down to this is a vaccine that helps to confer individual protection against what can lead to cancer, but there's not thought to be, in a school setting, a concern about contagion. And so there are a lot of reasons behind some of the disparities that we see.
Yeah, I want to come back to that. Dr. Wheeler?
Yeah, and there are some states that have made the HPV vaccine mandatory. So this is a state-by-state decision about what's required to attend school. So theoretically, all schools in Arkansas should require students to present evidence of immunization before they're allowed into school. If the family chooses not to do that, they can go through an exemption process that's required, but otherwise they should be up to date on their vaccines. One of the problems in the state is we have had problems with individual superintendents and school districts not necessarily being as careful about documenting that. And part of that is because it's so hard to document up-to-date status for students. One of the big pluses moving forward over the last few years has been the use of information technology to create registries, which we have in the state, which allow us to keep up with whether people have been vaccinated no matter where they go. They can go to another physician, they can go to an emergency room, they can go to the drugstore, they can go to the health department. In every one of those settings, that immunization should be recorded in the registry.
No matter the, go ahead, doctor.
Well, I was going to say it initially started with children, but now we've got more and more of those vaccines, even for adults, in that registry. And so I actively work with my healthcare team in my group to look at that registry and use that information to help drive effective use of vaccines in adults. Because, if we think about our goal is to provide the highest quality, evidence-based care at the lowest cost to individuals and society. And so if I, for example, need a tetanus and whooping cough vaccine, and I think I need it, and I've had it 3 years ago, there's no reason for me to get that again. And if I've got an information system or an office record that shows that it's been done, we can say, no, you can wait until you need to have this again, either from an exposure or that kind of thing. So right-sizing it is important.
And I think you brought up a good point a minute ago about preventive care. Just you mentioned, one of the disparities is people kind of going in for their routine checkups. Everybody should go in for their annual checkup, and not only should you be getting your cholesterol screened and your blood pressure screened, but you also need to be asking your physician about what immunizations do I need. A lot of times, especially healthy adults, forget the fact that they need to get a tetanus booster every 5 to 10 years. Are you 50-year-olds? 50 comes very quickly. You don't realize that there's other vaccines that you now need to start looking to getting on an annual basis if you have chronic medical conditions. So it's a very important thing. I think we've all kind of moved away from this focus on just going to the doctor when you're sick and going to the doctor and moving towards going to the doctor when you're well. And so getting those annual checkups is really very important.
Focus on prevention.
Mm-hmm. In a way, I lament being old enough to have covered Betty bumpers in the early 1970s, when I think it was Every Child by 74.
Every child.
Yeah.
Well, now it's Every Child by 2.
Well, we can't. Well, yeah, she was the first. Then First Lady, Mrs. Bumpers, was as were many of us, to know that so many thousands of Arkansas youngsters didn't even have a measles vaccine, or some of the other basic stuff. We've moved, I gather, a lot farther since then, but there are still gaps.
Right.
Right.
There are caps and
Now, is that, let me refine it if I may to any who wish to. Is that a gap in the in parental understanding or appreciation, or in the delivery mechanism, either state or private? Why are these gaps still?
There are a number of gaps. Part of it boils down to there are a lot of people that have beliefs that don't support immunization. Now, from the medical side of things, we know the value of vaccines. We can cite numbers on the very, very low risk of every one of the vaccines that we use in children and adults. But there's still a number of people that don't get vaccinated, and tracking some of those people that are not vaccinated is important for us in trying to respond to outbreaks, the battle we're having with mumps in the state right now. There are a lot of people that have insurance plans that may only cover some vaccines but not others. Medicare, for example, covers the tetanus and whooping cough vaccine and the shingles vaccine only as part of your drug benefit, not part of your medical care benefit with your physician, as an example. So insurance provider can be a difference. There are some people who are in areas that there aren't enough providers. So there are a number of different issues that play into our gaps in our society.
I think just to emphasize a couple of points, while there are a lot of parents who maybe have decided that they don't want their kids to have vaccine, it's really a very small number in the state. We're talking, if you look at kindergartners, it's less than 1.5% of children who have taken a medical exemption and decided voluntarily not to get their vaccines. Most of the problem we have are economic and access issues, again, as you suggested in your earlier comments. And part of it is just the priority. As you alluded to, for a lot of people, they don't wake up every morning wondering whether they've been vaccinated or not. They've got other very pressing issues, and I think you suggested earlier that maybe poverty and other kind of issues in the state might have an impact. And I think they do in terms of general access to care, which includes immunization as well.
We are talking here about the very sensitive matters from the term, more sensitive in some households than others. Very sensitive matter of parental control, parental responsibility, parental authority over a child's upbringing, to include his or her medical care. What do you tell, gentlemen, a parent who says, I have heard that if I get such and such a shot, if Susie gets such and such, she is far more liable to autism, for example. That was the rage for a time. Chad?
Yeah, I think just speaking from the general pediatrician standpoint, I'm still in private practice as well, but I think most of the time the parents just simply are sometimes misunderstood. Sometimes their reasons for not wanting to get the vaccine aren't fully explored. I think being a parent, it's very difficult. We all know that, and it's you're like you said, in charge of this child's life, and it's the thing that you love more than anything. And I think parents are also often coming from a place of where they really want to help their child. They're not coming from a place that they want to hurt their child. They're not trying to they don't want their child to get these diseases. But I think a lot of times just kind of trying to sit down with them, talk to them, find out where they're coming from, find out what their understanding of things are, and then I think that's where the discussion about what the evidence actually is. I think you brought up autism, and a lot of parents worried about that it still goes on today. But now we have tons and tons of studies to show that there is no link to autism. So a lot of times parents just haven't had access to that information, and they do trust you as a medical provider. And I think if you respect what they feel, and if they have a good respect for you, you're going to come to a good mutual decision about vaccination. And I have had people that we have had a discussion, and I let them think on it for 3 days, and we kind of give a deadline. And I would say 90% of the time they come back within that 3 days for their vaccination.
The other piece that I often emphasize also is that I'm a parent. I have 3 children. All 3 of my children have been vaccinated to the level that they need to be vaccinated, because I very strongly believe that I want to protect my children as best I can, and I know that these vaccines are safe based on science. There are clearly lots of pieces of information out there, and I will say misinformation, about the risks of vaccines. And there are people that have, unfortunately, something to gain for propagating some of those adverse things that are not true. And so I think we've got to recognize and to let our parents and our patients know that we care about them. You know, I want to vaccinate you, or I want to vaccinate your child because I care about you and you are a contributor to my community and my society. I'm not doing it to hurt you. I'm doing it to help you.
The other piece of that information, and we talked earlier about seeing polio, which has been essentially erased from this hemisphere. But some of us are old enough to have seen those cases. And I'm a pediatric infectious disease doctor, so I see the complications of vaccine preventable disease in kids who don't have vaccines. In the early 90s, we didn't have a vaccine for chickenpox. And we would see these kids come in with terrible, terrible secondary bacterial complications. They would lose arms, they would lose limbs, and sometimes lose their life because of the complication. It didn't happen very often, but it did happen. And we don't see that anymore. The success that we've had with the vaccine program in the United States and around the world is extraordinary in terms of the lives saved and the complications that kids have avoided.
And the carry on from that chickenpox is those that were able to vaccinate for chickenpox and prevent that disease also aren't at risk of having shingles. But if you've had native chickenpox, you're at risk of shingles for the rest of your life. Another thing that we can vaccinate for and prevent.
I had chickenpox as a kid, but I got the shot. We were talking earlier too about the HPV vaccine.
Yes.
Another sensitive, especially because it involves if a majority, if not all of the cases, generally are sexually born or transmitted. It makes it very difficult for parents to talk about it, even with their physician. And yet the evidence would seem to suggest that immunization can eliminate so much of the cervical cancer and many other cancers.
Right.
But it's the idea of a youngster or of the society, the culture, or even the government encouraging adolescent sexual activity.
Right.
Well, and you know, again, as the parent of two teenagers, you know, we recognize that unfortunately there are young people that are going to have sex before they should. This vaccine, honestly, is best given before anybody has any sexual encounters whatsoever, because HPV is so incredibly common in our world that if you're exposed to HPV, a type that's in the vaccine, and then get the vaccine later, you don't get protection against the types you've been exposed to previously. So I want to give it to young people that have had no contact with HPV so that I can protect them from as many types of that virus as possible. With this vaccine, potentially we can eliminate well over 90% of cervical cancer.
90%.
95% if you look at the current data. We can prevent many upper airway cancers. We can prevent many other cancers of the genital organs. But the best way to protect those young people is to give them the vaccine prior to even considering the word sex. And I tell people all the time, I've vaccinated my two sons because I want them protected. My daughter, when she's old enough, she'll get that vaccine because I want her protected, and it is safe and effective.
Right. I wish we had done with HPV what we did with hepatitis B. We haven't talked about that, but that's a sexually transmitted disease. We give the vaccine the day the baby's born in the hospital or shortly after, and complete that series over the next few months. And that prevents liver cancer. And we're already starting to see the benefits of that from this program that we started a decade or so ago as a mandatory vaccine. I wish we had done HPV that way and started it in early childhood, because we wouldn't be having this discussion of sexuality. But it got developed the way it did and designed and tested in adolescence. But our message is always not about sexual activity. This is a cancer prevention vaccine. And again, I think we all know or have seen friends who have died from cervical cancer, and it's a terrible, terrible thing to have to experience that we can completely avoid.
On to viewers' questions now. It's probably past time anyway, but here's the first one, and it comes from a viewer in Johnson County to whomever would like to address it. At what age should we start receiving pneumonia shots, and what evidence is there that they actually work?
Okay. Well, our children get pneumonia shots, believe it or not, starting in infancy, starting at 2 months of age. But most adults have not had any of the pneumonia vaccines. Generally, for healthy adults, you don't need a pneumonia vaccine until age 65. And they're actually two different pneumonia vaccines, and you need both of them to get the best protection. Now, for younger adults that have a number of health conditions, including heart disease, lung disease, cancer, have a suppressed immune system, either from disease or from treatments from your doctor, we need to give those pneumonia vaccines at an earlier age. So I've given the adult type pneumonia vaccines as early as age 18, but I've also given it to people as old as 95. It really depends on the particular condition of that individual.
Here's a Lee County questioner, a viewer who wants to know, have we pinpointed the allergy or the allergic reaction in the ingredients in the measles vaccine? Anybody want to take up allergic reactions to measles?
Well, there was a concern, and there has been a concern about different allergic reactions that occur from vaccines. And at one point, some of our vaccines contain a lot of egg protein, for instance, the flu vaccine. Other vaccines contain animal gelatin and protein that kids might be sensitive to. The amounts of those proteins are very, very low, and yet there will be an occasional child who has what appears to be an allergic reaction to one of the vaccine components. Those are so uncommon, we usually refer those patients to an allergist to break it down and figure out what the reactive component is and to make sure they don't get exposed with future vaccines. But it's an uncommon event.
Yeah, and when it does occur, though, are the symptoms severe or the effects profound?
It depends on the individual. In almost all cases, they're relatively mild, and you may get some hives. It's very rare to have a severe life-threatening episode. It's a 1 in a million chance, literally.
Yeah, I think
for flu vaccine, the data is 1 in 500,000 to 1 in 4 million. That's that uncommon for people to have a serious allergic reaction.
1 in 4 million.
But 1 in between 500,000 and 4 million. So it's very, very uncommon.
And a lot of times what people think are allergic reactions are not really allergic reactions. I mean, sometimes you do get a little achy after you get a vaccine, or like as Dr. Wheeler said, you might get hives, which is a form of allergic reaction, but it's not a severe allergic reaction. People use the egg allergy as a barrier a lot to getting the flu shot, and like Dr. Hopkins said, and really we now know that a lot of people who even have a mild egg allergy can still have their flu shot and will have no reaction. So it's really an individual basis, but it shouldn't be a barrier to getting your flu vaccine, and really should talk with your doctor or with your allergist if you see an allergist.
And even people that have severe allergy to eggs, we now have vaccines for flu that contain no egg whatsoever.
Right.
So we have multiple different options for vaccines that often, if you have someone that has a severe allergy, we can work around that and still provide protection.
This is a pretty open-ended question here, but it comes from a Craighead County viewer who wants to know why do people have to get appointments for their immunizations?
Well, let me tackle that.
What are their options?
Let me tackle that a little bit. For adults, you probably don't need an appointment to get any adult vaccine, because you can get adult vaccines at most pharmacies on a walk-in basis. Most of our every pharmacist in Arkansas, just about, has been certified to be a vaccinating pharmacist, and so most pharmacies are going to be able to give you most adult vaccines. Now, for children, the scheduling of vaccines can be a challenge, and oftentimes in children, what we try to do is to leverage our opportunities to provide multiple levels of prevention, from vaccination to assessing development to looking at growth and that kind of thing. And so many times for children, we want to have them in for a regular appointment so we can do all of those other things in addition to giving them those vaccines for prevention.
Again, I think that really ties the importance to preventive care. I mean, a lot of times people would never come in for a checkup if they didn't have to come in to get their shots, and so it's just. And fortunately, as pediatricians, we
get them any way you can get them in.
That's right, and we like those shot visits. I mean, you have some kids that were, from the time they were 4 to 10 that have never seen a doctor, and it's a really good opportunity to get kids in and try to recognize things early before. It's not just about vaccines; it's about other screening things that need to be done.
Want to honor all the viewers in the states surrounding Arkansas, many of whom take advantage of this network. And for example, this caller from Dunklin, Missouri, recognizing that you guys are all licensed and practice in the state of Arkansas, but this Missouri viewer wonders exactly what codes, what statutes are in place that demand which immunizations? What is the level of immunization law?
Right.
Recognizing that you can't address Missouri specifically.
Right.
Let's take Arkansas, that's enough.
Yeah. So again, the requirements are state by state. There are some that are fairly common against around the 50 states. And most people follow, or most states follow the guidelines that come from the CDC and what's called the Immunization Practice Committee, which will set guidelines for what they think should be mandatory vaccines. In the state of Arkansas, virtually all of the vaccines that are recommended by the CDC are required for school entry, except the ones in the very early childhood, like rotavirus, that you would not need for school entry. And then the HPV vaccine is not required in this state, and I'm pretty sure it's not in Missouri either. And then those are, the way that we write our regulations are sometimes a little bit different than the CDC to account for the fact that kids are in school. And so we might get a recommendation from the CDC that says you should have a vaccine at age 11, and we may convert that and say, well, you need to get it in the 6th grade or 7th grade or something like that, just to make things easier for the school system, because our regulations are required for school entry. So that's the template that we work with.
Yeah. Does that extend to private schools too?
Yes.
Or?
Yes.
Yes. All schools.
Okay.
All schools.
All right, here's a call from White County with a specific question about the the components of vaccine. It's made specific reference to mercury in vaccines. We've read about this before. Who wants to take?
Well, there's a product that's used as a preservative in many vaccines called thimerosal. Thimerosal has very tiny amounts of mercury ions within that. That mercury really is not available to cause harm itself. It's actually complexed in a product that it really can't escape from that product and build up in your tissues. This is very different from when we talk about mercury toxicity from fish, or mercury toxicity from exposures in a chemical spill or that kind of thing, where you get free mercury that is available and can cause severe toxicity. Thimerosal has been shown to be a very safe preservative, and frankly, there is much, much less of that used in vaccines now than there was even 10 years ago.
Right, and actually we haven't had any thimerosal in childhood vaccines since 2001. It's used as a preservative in a vial where you have to take multiple doses out of a vial. And so the industry, because of this concern, essentially provides vaccines in a one-shot type of process now. So there's no preservative needed in the childhood vaccines. So since 2001, there's really not been any. There's some in the flu vaccines, but you can get thimerosal-free flu vaccines if you need it just by getting a single vial.
We made mention earlier in the broadcast about mumps and its resurgence, or its reappearance anyway. Did it surprise the clinical community?
Yes.
Yes.
Yes and no. In that, over the last 10 years, and I'll speak from the public health department point of view, there's been about, 8 or 10 outbreaks of mumps in the country in the last decade or so. And interestingly, they've all been in situations where you had very crowded people put together in crowded situations. So military barracks, school dormitories, private schools with dormitories. And in this case, in Northwest Arkansas, it's been in communities where we had very, very dense housing with lots of people and apartments. The surprise is that it looks like there's a single strain of mumps that is predominant in each one of these outbreaks. And it looks like the current vaccine that we have may not be as potent for that particular strain as it is for all the other strains. That said, the current vaccine that we have still works pretty well. Kids who are not in these dense settings are not tending to acquire mumps as much as kids that are in the more dense living situations. So we know that vaccines are not perfect. We know that the mumps vaccine, if you take 100 kids and vaccinate them, only about 88 will mount an immune response and the other 10 or 12 will not. And so they remain vulnerable. But as long as most of the kids are immunized, then you have what we call community immunity. So even if maybe a wild-type mumps comes into that group, it may spread to one person, maybe two people, but it won't spread much further. So this particular epidemic that we're having is kind of a combination of a couple of things. It's just the random fact that perhaps a certain number of people who didn't respond well to the vaccine happen to be living together in very dense settings, but it's really taken off. So far, it's limited to Northwest Arkansas, but yes, we were surprised. No, we weren't expecting it. We're using the typical methods that we do use to contain an epidemic, and we're hoping that very shortly we'll see a nosedive in the number of cases that we're seeing.
You've got the mumps. How bad are the mumps?
Mumps can be bad. They can be bad. I mean, we think of people having swelling of the parotid glands, but you can also have severe swelling of the testicles. You can have swelling of other of those types of tissues. You can potentially get enough of a decline in your immune system or get a secondary bacterial infection and have people sick enough that they end up in the intensive care unit or die. It's not nearly as common to have death from mumps as it is from measles or from hepatitis or some of these others, but mumps is not a trivial disease, much as chickenpox is not a trivial disease.
And I may embarrass myself a little bit, but having just been trained more recently in the time of vaccines, so you have a lot of pediatricians, a lot of doctors out there who have never seen these vaccinable, preventable diseases. So I had a child that came in actually for follow-up, but he looked pretty healthy and he had swelling on the face. He had already seen another doctor and was just following up because he hadn't really improved much, but he really wasn't that sick. But mumps was not totally high on my level of things that I was thinking about because mumps has just not been that common thanks to vaccines. So, I think that it really took us by surprise. I mean, 2 or 3 days later, I learned that, that mumps was, there was an outbreak in Arkansas, and all of a sudden I was like, I sort of missed that. Fortunately, the kid did fine, but.
Well, here's a viewer who wants to know, is there an age cap really for mumps vaccine? I mean, is it likely to occur in someone 65 or older, for example?
Yes, we're seeing, in this current outbreak, we're seeing about 2/3 of the cases are in people under 18, but it's also occurring in adults of all ages.
There's a question that why doesn't Medicare, for example, cover the shingles vaccine, and why is it so expensive?
Well, I can't necessarily answer the question about expense. I think if you asked any of the three of us or most patients and providers, I think many of us are in great dismay about the cost of many, if not all, pharmaceuticals in this country. But Medicare made a decision when the shingles vaccine came out, and also regarding the tetanus vaccine, which also protects us against whooping cough, to cover those under their drug plan, their Part D plan, rather than under the Part B or the physician and medical care side of things. That was a decision that was made in Washington. Many physician groups have advocated potentially moving that to a Part B service, but that would require congressional action, and at present that's a bit of a challenge.
Should seniors be especially concerned about shingles?
Shingles is more common with aging, and so generally we recommend that shingles vaccine be given starting at age 60. And what I try to do in my patients is to give that shingles vaccine between ages 60 and 65, because then we typically don't get into the Medicare coverage issue, and it's covered by all private plans because it's recommended by the advisory committee of CDC, as all private plans are required to cover vaccines that are recommended by the advisory committee.
Is it available from the state health department?
We provide immunizations largely for children and for adults only in the setting of an outbreak, so it's not usually provided by the health department.
Also from another question from the Delta, an individual who has been informed, if I'm understanding, reading the question correctly, has been informed by a physician that he or she may not be a good candidate for a flu shot because of side effects. Now,
that would be exceedingly uncommon. In general, if I have somebody that's had side effects from the flu shot, most commonly what those side effects will be is might have gotten achy, might have a little fever, might have soreness at the site of the vaccine. In those situations, generally I consider that not a good thing that my patient is uncomfortable, But those symptoms usually are coming on with your immune system being activated. And so that may be a sign that you're actually getting potentially better protection from that vaccine than if you had no symptoms whatsoever. The only time I can think that I might have advised a different flu vaccine than the standard is somebody who had something that we're considering potentially anaphylaxis or severe allergy to a previous flu vaccine. And in that situation, I would recommend one of the 2 egg-free vaccines. So there is not a reason from an allergy standpoint that everybody in Arkansas that's over 6 months of age shouldn't get vaccinated against the flu.
There are some rare complications of the flu vaccine, as there are with any of the vaccines, that neuromuscular diseases like Guillain-Barré, where you would need a doctor's advice about whether to get a vaccine again. But really, it's, as you pointed out earlier, it's an extremely rare event to have a serious reaction to flu vaccine.
And if you can't get the vaccine, then during the flu season, number one, try to avoid people with flu. People around you can get the flu vaccine to protect you. And if you think you have the flu, then you need to go to the doctor quickly, because there are things you can do to kind of help. I mean, just make the symptoms of the flu a little bit easier to take.
Right. One of the most important groups of people to get flu vaccine are pregnant women. Do you want to talk about that?
Sure. Pregnant women are a real opportunity and a challenge. We have had a lot of concerns over the years about using vaccines or providing any medication to pregnant women. But we've got good evidence now that vaccinating pregnant women for the flu and also giving them a tetanus and whooping cough vaccine are vitally important to protect that pregnant woman, but also to protect that baby. And so we recommend the tetanus and whooping cough vaccine in the beginning of the 3rd trimester to help passively immunize that child to protect them against whooping cough until they're old enough to be vaccinated themselves.
So in utero, they can...
In utero, you can pass some of that antibody. Some of your immunity as a mother, you can pass that on to your child.
Right.
And giving that flu vaccine, if it's flu season and you're pregnant, you need a flu vaccine now.
Right. And it's to protect both the baby and the mom, because if a mom is pregnant and gets the flu, the complication rates can be very bad.
For them.
For both.
Yeah, and because if the mom is having difficulty and the baby's still only a few weeks away from the optimal delivery time, then you have the accidental delivery of an early preterm infant, so that can be really bad. We had a woman several years ago that wound up in St. Louis with flu and on the ventilator, and again had not. There are women like this who have not received their vaccine, and this could have been avoided. The other thing is you can't immunize babies till they're 6 months of age. So they're not really protected from the time they're born until they're 6 months unless their mom has had that vaccine.
Okay. I was kind of waiting for this to come up, given the temper of the times, but a caller wants to know if immigrants to the U.S. from other countries, unspecified, should prompt any of us to upgrade our immunizations or to seek boosters for maladies for which we've already been immunized in the years early.
Well, to be honest, I mean, we live in a world where you can go around the globe in the whole 24 hours and can be exposed to any sort of environment. Even when you think about things like Ebola, that people really panicked about. We were just one flight away to New York City, and these are people who are coming into the States in all forms and fashion. So I think, if you have your routine immunizations, then you're going to be protected for most diseases. If you're going to be traveling to somewhere in the world, you can always consult with your doctor. There's practices that actually specialize in international health and can help direct you on vaccines. But I think, too, a lot of people dealing with children that are adopted internationally, a lot of times we go ahead and choose to re-immunize those children just to make sure that they have all of their routine immunizations that are what we would recommend here in the States.
But immigrants don't bring a risk, generally, of these vaccine-preventable diseases to us.
Right. The other thing I'll mention is most countries vaccinate against a lot of these primary diseases, not all of them, but most of them. So kids in other countries coming here typically have had an appropriate vaccine equivalent to what we've had. We have a much broader spectrum of vaccines in this country, but the main ones, the tetanus, measles, mumps, and rubella, and polio, most kids in the world have access to that now.
The St. Francis County viewer wonders, is there just more flu these days, more strains, more varieties of it? The viewer does not see, upon reflection, doesn't seem to recall that much discussion of the flu 25, 30 years ago.
Flu has been around for time immemorial. You know, the greatest outbreak of flu to affect this country was in 1918, around the end of the First World War. And I think the estimates were 6 to 9 million people killed in the United States from the flu. Average in this country is between 3 and 50,000 deaths a year from flu, and that's going back to the 1970s. And up to 250,000 hospitalizations related to flu and complications from people getting the flu. And so there are years where we have more severe flu, more hospitalizations, more deaths than there are other years. But if we're going to be safe, if we're going to try to do the best to take care of ourselves and our families, all adults and kids 6 months of age and older annually need a flu shot.
We toss the word flu, it occurs to me, we toss the word flu around a lot. When I've got the flu. No, you've got a cold. You know if you have the flu.
Typically with the flu, you should think of 4 things. 1, high fever. 2, severe body aches. 3, it's not going to go away in 3 to 5 days. And 4th, usually have some degree of cough. Those are probably the cardinal things to think about with the flu. It is not a simple cold. Typically people are, the old historic term, prostrate unto death feeling because they're so miserable from this illness, as opposed to a cold, which many people will get up out of bed and function just fine.
That's
It's
an important distinction too, because most of the time with colds you have nasal symptoms, which you typically do not have with flu. So if you've got a stuffy nose and that kind of thing, most of the time you don't have the flu, you have some other type of viral syndrome. It's still infectious, and you need to wash your hands and not be around other people, but it may not be the flu.
And also important to remember that even though we talk about how bad you feel with the flu, there are people that can have the flu that hasn't yet built up to that stage, that can be shedding the flu in the community, that really aren't that sick.
Right.
And so one of our other areas other than pregnant women is every healthcare worker, whether it be the front desk clerk in your office, the doctor, the nurse, the EMT, every healthcare worker should get the flu vaccine. That's a quality measure of trying to provide safety for the patients that you take care of.
From Jefferson County, a viewer wonders if an individual with cerebral palsy should receive, are there any guidelines or rules regarding vaccinations for an individual with cerebral palsy?
They need unless they're actively having seizures at this time that are not well controlled with medication, that a person with cerebral palsy should need all of the vaccines for a person of that age. So either an adult need the adult vaccine set, or a child, the childhood vaccine set.
Cerebral palsy falls under that chronic condition sort of thing too, because of sometimes they have some compromise of their breathing and they're not able to clear their airways and stuff. They're at higher risk for things like pneumonia and at higher risk for getting sicker from the flu. So again, just making sure that those individuals are well immunized for those things.
A Pope County viewer wonders, will there ever be a vaccine for hepatitis C?
There are active trials going on right now trying to develop vaccines for hepatitis C, for HIV, for Zika. There are studies going on trying to develop what I would call the Holy Grail flu vaccine, a flu vaccine that could be given just maybe once with a booster every 2 to 5 years to protect you against multiple strains and help avoid us having to rush to get it done every fall. So there's lots of vaccine research going on around this country.
I think Bob brings up an important point that the science of vaccinology is an absolutely constantly evolving process. And part of it has to do with that the world that we live in is not stable, that there are new pathogens that emerge from time to time. There are new technologies that develop. We talk about cell-free systems that we can now grow, or molecular mechanisms we can use to create vaccines. So we're going to continue to have a very complex vaccine system that'll just get more complicated with time, but ideally will prevent more diseases. And we've talked about using vaccines for infectious diseases, but we've also mentioned too that are cancer prevention vaccines. And we're probably going to see more vaccines in the future that are targeted at immune disorders or cancers and other things. When we all started at different times in our practices, the vaccine schedule could be rattled off easily by a third-year medical student. And now it's literally pages long with all sorts of caveats for the special conditions. So we all have our little cheat lists in the office of the vaccine schedules, the variations that may occur for one reason or another. And then the other adventure we always get to deal with is product shortages. From time to time, we'll have a shortage of a vaccine and we'll have to adjust schedules, and it's really a big, complicated process. It takes up a lot of time for physicians who provide vaccines in their offices.
When a new strain of flu emerges, how long does it take the community to respond with an effective vaccine?
Again, this is a technology thing, and it's the period is getting shorter and shorter. It used to take at least a year. Now it's probably 4 to 6 months from the time of a new strain before we can actually create a candidate strain, test it, make sure that it's ready for people, and get it out and distribute it.
If I had the mumps as a child, 1 week on one side and 1 week on the other, can I still get the mumps as an adult?
Sounds like you were pretty unlucky to start.
If it weren't for that luck factor, I'd say the likelihood is very, very low. But the fact that you got one side then the other, that's right.
We actually, for people who were born before 1957, we assume that they all had mumps vaccine, or had mumps, and that they have lifelong protection. But even then, we still recommend for certain groups of people, like healthcare workers that were born before that time, that they still get a vaccine as an adult, because their immunity can wane over time.
We're asked to, again, or you are asked, gentlemen, asked to reflect again on the importance of seniors getting pneumonia vaccinations.
So seniors 65 and older should get 2 pneumonia vaccines. The first one is a vaccine that is called the 13-valent conjugate vaccine. The brand name of it is a vaccine called Prevnar. And then a year later, they should get the traditional pneumonia vaccine, which we call Pneumovax 23. So they should have both of those separated by about a year, unless they have a health condition that would make you compress that interval.
Well, this may be pertinent. The viewer wants to know, can you be too old to be immunized against a viral infection, pneumonia or whatever? Can your health be so fragile, if only measured in years, that you would be?
If you're young enough to write that question or to call in, you're young enough to be vaccinated. No, in all seriousness, our immune systems do not respond as well to influenza vaccine and others the older we get. But if you get some protection, and the risk is very low of side effects from that vaccine, I would take a little bit of protection over no protection by not vaccinating. And so in just about everyone, I'm going to recommend a flu vaccine. If I have an older adult who's even in their 90s that has not had the pneumonia vaccines, I'm going to give those. If I have an older adult that's not had the tetanus and whooping cough vaccine, I'm going to give those vaccines. We recognize they may not work as well, but a little bit of prevention is better than none.
One of our big targets for the health department and also provider are nursing homes, where people are typically very debilitated, but we know that vaccines are protective in that situation and help prevent outbreaks in nursing homes.
Here's a viewer who had chicken pox in their youth, and sure enough went on to have shingles and is recovering. Does that person need to be immunized, or does that episode of shingles immunize them?
Well, the episode of shingles gives them some protection, but it's not going to last forever. Generally, what I recommend and what most of the experts in the advisory committee from the CDC recommend is wait about a year from your episode of shingles and then give the shingles vaccine to try to prolong that protection against another episode of shingles.
And true, a lot of times you get those childhood vaccines, like chickenpox would be the perfect example, the varicella, which is, again, the virus that goes on and causes shingles later in life. But when we started, we were just giving 1 dose of the Varivax. And of course, over time, what we realized is that immunity over time really started to go down. And so it was really important for kids to get re-immunized when they were 11 or 12. So, things are always kind of getting better. There's always research being done. I think, any chance or opportunity sometimes to boost your immunity is a good thing. A lot of people forget about getting their tetanus booster, but really you need that every 5 to 10 years to keep it primarily for the whooping cough. People think they just need their tetanus shot if they get a bad cut or wound, but it's real important to get that whooping cough. And I wanted to add on to his thing earlier, for older adults, there's no better opportunity to get your tetanus booster than when you have that first grandbaby, just to protect them against the whooping cough.
All right. Well, Dr. Wheeler mentioned a second ago the schedule of immunizations. And this is anecdotal, of course, but it seems like when I was a pup, DPT was it. I mean, that was just sort of, maybe that was just the shorthand for a series of more immunizations. Now, obviously, we had polio and smallpox on the school ground, but it's much more complicated today.
Right. It really is.
And comprehensive.
Right. So there's a whole group of other pathogens that when you and I were born, we didn't have access to. Probably the most dramatic one that I think we've all seen is a bacterial vaccine called Haemophilus influenza B. And it was introduced initially as one type of vaccine. They made some improvements upon it. And it's been almost 25 years since I've seen a case of bacterial meningitis by this organism. And we used to see a couple of dozen at least every year in the hospital. Each one of us would have seen that many. So that's one that's been completely eliminated. So there's been an effort to take lots and lots of different vaccines, old ones and new ones, put them together in combination so that a patient might get one shot, but they would be protected against 5 different organisms, for instance. So we're going to see continued evolution in the development of products to limit the number of shots that a baby has to get, which will be great news to everybody. And I think that work will continue for years until we get, as you said, the perfect vaccine that's one shot that lasts forever.
Well, we've talked now about vaccines that we already have or are rapidly evolving regarding, I guess, respiratory infections, flu, cold, pneumonia, whatever, and also cancers. But what can you advise us, and a viewer requested ask specifically about Alzheimer's, for example. Is there a vaccine that could conceivably be employed to prevent Alzheimer's? But beyond that, share with us, if you will, what are we on the cusp of developing some vaccines for other ailments that we haven't even considered yet on this program? Anyway.
Well, we've got lots of vaccine research going on in a lot of different directions. Medical research is one of the things that I think has been a strength in medicine and in science in this country and across Europe and many other parts of the world. We're seeing development of more and more vaccines that target different infectious organisms. There are trials going on looking at therapeutic vaccines to target some particular cancers here at UAMS and a number of other places. There are vaccines that are being used to target particular parts of a cancer even. There's not any trials that I know of to date of any vaccines that have shown promise for Alzheimer's, but that's not to say that there aren't things out there. It's just not that I've seen at this point. I would say over the next 15 to 20 years, vaccinology is kind of a sub-area of medicine that I really enjoy and I spend a lot of my time in. But what I know now, I would venture to say 20 years from now, would be the head of a pin to what we'll know about vaccinology with some of the new molecular and DNA technologies and research tools that have been developed in the last 20 years.
We had a question earlier about immigrants want to run another strain to the U.S. Here's a viewer who's planning to travel abroad. Should he or she be especially vigilant given some outbreaks that have occurred the subcontinent or?
Yeah. Well, what I advise everybody to do is go to the CDC website, and they have a whole section on travel. And they have very specific by country guidelines on what immunization, what medicines you need for malaria and other kind of things. And that's probably the first step. And then here in Little Rock, there's a number of resources where they can go to travel clinics, and some pharmacies have travel programs. You can go in and check with them, tell them where you're going, and they'll fix you right up.
What they might do is take that information for what country they're traveling to from the CDC website, print it out and take it with them.
Right.
That may speed the process along with whatever provider they see to get the right thing done, the right timing, to keep them safe for their trip.
And that's an important point. A lot of these vaccines need to be given 4 to 6 weeks before you travel.
All right.
Yeah, or may need boosters too. So you want to be sure to give yourself time to get boosters.
Yeah. Looking at the globe, is this a more infectious age that we're in than before?
I think in a lot of ways it's probably less infectious. You know, you look at the advances we've had in clean water, in sanitation, those kind of things are pluses. The challenge is that we're so mobile and it's so easy to travel from place to place. If something gets started, it's probably easier for it to get propagated.
Right.
You know, you look at Ebola in this last set of outbreaks in Africa about 1.5 years ago. You had cases in Europe, you had cases in the United States related to people flying back from the area where the outbreak was. And so it really brings to the importance of public health, and not every place in the world has as good a public health infrastructure as we have in the United States. You know, and have people that can quickly get in and investigate, try to help the people to properly respond to what that outbreak is, and minimize the spread, as well as help the providers in that area to take care of those that are sick from whatever the disease may be.
Doctors, we're out of time. Thank you. Your shift has ended. Thanks very much for being with us. Thank you for watching. We hope this has been a valuable program. See you next time.